Hi, I'm Katelyn Wargel, and I'm excited to talk to you about some of my research today. So I'm going to start with a statement that may be obvious to you, maybe not, depending on your background, but children's mental health matters. It matters for their development, for their ability to make peer relationships, do well in school, gain independence, and develop on a trajectory that is happy for them. Now, what's great about this is that a lot of schools are putting forth so much effort into attuning to students' mental health needs and providing them with resources. A problem that often arises, however, is that these approaches might be a little uncoordinated. So schools might have a lot of connections and a lot of different staff members who are able to provide students with mental health support, but this is often done in silos, and schools often don't have the full resources needed to really support these professionals and help them help the students. What this results in usually is duplicated services that are competing for funds, might be confusing for families who need the services, and might leave students falling through the cracks, and just overall has a less desired outcome than wanted on the improvement of students' mental health. So what can we do about this? How do we align the opportunities and the services that schools have so that they're working together to overcome these silos and provide better supports for students' mental health? One opportunity is by creating interdisciplinary teams at the schools or at a school district that pull in the school psychologists, school social worker, teachers, parents, families, community providers who can work together to get everyone on the same page for a strategic approach that is consistent. Overall, interdisciplinary teams used for school-based mental health have shown to have better outcomes for students' overall mental health. So why not use them all the time? Well, school staff and faculty are often overburdened, under-resourced, already asked to be on so many teams and committees. And if they're asked to be on one more team, particularly a team that is doing a lot of work, spending a lot of time, but is ineffective, that can actually increase burnout of a staff and workforce that typically already experiences high levels of burnout. So if we want to implement an interdisciplinary team approach, it has to be done right. And that's what I wanted to learn more about with this project. How can schools build an effective interdisciplinary team-based approach to support students' mental health? And I'm going to answer that by using a systemic review. This means I'm going to gather as much public literature as I can that's been published on this topic, use qualitative analyses to gather the themes from the studies that have already been done, and put those together in a user guide that schools, community members, principals can use to develop an effective interdisciplinary team-based approach that uses resources well, doesn't increase burnout, and supports students' mental health. So where am I at in this process? I'm right in between steps 1 and 2. I'm not quite to the user guide yet. But I've been looking at the literature and I've been able to find a few initial findings that will guide the ultimate user guide. So what's emerging? First of all, really simple things. The team structure matters. How many people are on the team, who is represented, and even the routines and the meeting, the emails, the way things are talked about on these teams matters for how effective they can be and what kind of projects they can do well. A team leader who facilitates openness and allows a team to be creative is vital for a team to be successful. Teams, particularly those that are interdisciplinary in nature, need to create dictionaries that allow them to create a shared understanding so that they know they're talking about and working towards the same things, even if they're using different professional jargon. And finally, successful teams have concrete decision-making processes that they can apply to any problem that comes their way. It's a series of steps that they use as a guide to come to conclusions about different problems instead of starting all over from the beginning each and every time there's a new problem. All of these things make teams more efficient and ultimately can lead to better mental health outcomes for students when they're applied in a school setting for school-based mental health. So what's to come? I'm hoping to have full results soon that I could share in another platform. If you're interested in learning more or have questions about my references, please send an email to me. but I'm hoping to continue to gather more information on this, put it in a guide that's really practically user for the practitioners out there, and then see what comes up next. I'm not sure right now, but I'm excited to keep looking at it, and I'm really grateful that you were here listening to this project and would be glad to answer your questions if you reach out to me. Thank you.